Good afternoon and welcome to today's webinar, Child Health Specialty Clinics and the Regional Autism Assistance Program, helping Iowa children with autism and their families. Brought to you by Iowa Healthcare, Child Health Specialty Clinics, and the Regional Autism Assistance Program. I'm Shawn Wittrock and I will be moderating today's session. The session will be recorded and the link to that recording will be provided in an email following the webinar. You are free to type your questions in the Q&A box throughout the presentation and those will be answered at the end. CE credits will be available for those attending the live session, and directions for obtaining those credits will be shared at the conclusion of today's presentation. I am pleased to introduce and welcome our presenters today, Allison Drew and Cheryll Jones. Allison Drew is the program coordinator for the Regional Autism Assistance Program and has been with CHSC since 2020. Allison has served in various roles, including Family Navigator and Early Access Service Coordinator, where she provided family support. Allison is also a co-trainer for the Iowa Family Leadership Training Institute, which empowers families of children and youth with special health care needs to become strong advocates and leaders across the state of Iowa. She participated in the Association of Maternal and Child Health Leadership Lab in the spring of 2023, and Allison is the mother of 2 children with autism who have fueled her passion for her work. Cheryll Jones received her BSN from the University of Iowa and completed her pediatric nurse practitioner program also at the University of Iowa. Cheryll is currently employed as the health services coordinator for the Ottumwa Regional Center of Child Health Specialty Clinics and has held this position since 1977. In her capacity as health services coordinator, she provides diagnosis, evaluation, and care coordination services to children with special health care needs, which includes children exposed to drugs prior to birth. Cheryll also serves as the Children's Hospital Advocacy Representative on behalf of the Stead Family Department of Pediatrics and the UI Stead Family Children's Hospital. And Cheryll serves on a number of local, state, and national committees. So without further delay, I will turn the presentation over to Allison and Cheryll.
Thank you, Shawn. Like she said, I am Allison Drew, and I am presenting with Cheryll today, and we are excited to share about Child Health Specialty Clinics and the Regional Autism Assistance Program. And before we start, I just need to note that we have no disclosures for today's presentation. And here are today's learning objectives. Today, our goal is to introduce child health specialty clinics and the Regional Autism Assistance Program to you all. We're going to describe family navigation services and share about our clinical services across the state. And I'm going to give a brief overview of child health specialty clinics and the Regional Autism Assistance Program, and then Cheryll will share more about our clinical services. Child Health Specialty Clinics provides services and supports to Iowa children and youth with special health care needs and their families. We serve families statewide in all 99 counties, and our network of 13 regional centers, including our central office in Iowa City. We have 3 satellite locations, as you can see on the map here. Additionally, we have family navigators in Council Bluffs, Des Moines, and Iowa City, where there are other resources available, but we noted a need for family navigation services. We are generally located in areas that are more rural and otherwise have a gap in services. There are approximately 128,000 Iowa children and youth that either have or are at risk of having special health care needs. And special health care needs can be anything from chronic conditions like asthma or diabetes, mental, behavioral, or developmental disorders like anxiety or autism, or more complex medical diagnoses like spina bifida or cerebral palsy. And our teams consist of advanced registered nurse practitioners, registered nurses, family navigators, and then we do have dietitians at select regional centers, but they are able to serve across the state via telehealth. And each of our team members plays a really important role in our care coordination services, which are a big offering that we have at CHSC. Child health specialty clinics also provide services and supports through our regional centers, including gap filling clinical services, which Cheryl's going to present on in a little more detail here in a little bit. But we briefly, we provide health assessments for autism and other screenings, care coordination to help meet the needs and preferences of the child and their family, while also helping to connect them to the needed care and services and family to family support to help them meet their emotional needs and to let them know that they are not alone in their journey. We are really big on that family to family support. And one of the programs that we offer is the Iowa Regional Autism Assistance Program. We often call it RAP for short, but RAP teams help families navigate local supports and services for children and youth who have or are suspected to have autism spectrum disorder. RAP teams also serve statewide and are housed within the Child Health Specialty Clinics. And here's a brief summary of our history. So RAP was created through Iowa legislation in 1990, and it was designed to coordinate education, medical, and other services and supports for people with autism, their parents, and their providers who serve those with autism. And in 2013, there was additional legislation passed, and it created the Autism Support Program, which is funding for applied behavioral analysis for those who qualify. And this funding is provided by the Iowa Department of Health and Human Services and the Iowa Department of Education. So our RAP teams, which are uh, connected with our CHSC teams, are committed to ensuring that Iowans ages 0 to 21 with autism spectrum disorder have access to early intervention, treatment services, care coordination, and family-to-family support within their own community. We help families with a variety of services and supports. And as you can see on this slide, there's quite the list of things that we're able to help with, um, including, communicating with diagnostic facilities. We help them explore insurance coverage and payment options, helping them navigate the education system as well as other systems, finding an advocacy or family support group, connecting families to resources and information, and helping them coordinate care based on their needs and goals. It's very individualized to the family. But outside of our direct work with families, the RAP program works with statewide stakeholders to build partnerships. We have an expert panel of providers and parents that helps us guide and facilitate the current Iowa Autism Strategic Plan. And we also provide many evidence-based trainings and educational opportunities throughout the year to help educate primary care providers, parents, educators, other health providers, caregivers, family peer, and family support specialists in order to advance the Iowa system of care for children and youth with autism spectrum disorder. RAP services are for children and youth ages 0 to 21, and they are for those who are either diagnosed or suspect to have autism spectrum disorder, and they do need to be a resident of Iowa. And something that I feel really sets Child Health Specialty Clinics and RAP apart is our Family Navigator service. Our Family Navigators are staff members who are also the parents or primary caregivers of a child with special healthcare needs. They provide emotional support, systems navigation, and can connect them to resources within their own communities. So even though we are a statewide program, we have family navigators specifically located across the state so that they really know those resources really well. And all of our family navigators take a training and obtain the Iowa Family Peer Support Specialist certification through the Iowa Board of Certification, and they receive CEUs throughout the year to maintain that certification. Family navigators all have lived experience as a parent or primary caregiver of a child with special health care needs, and they work within our child community health teams. Like I said, family navigators are the parents or caregivers of children with special health care needs, and they have had those similar challenges. They have felt the same feelings of grief, sadness, loss, and joy, and they have found s- a variety of ways to take care of themselves and their families. And so they're able to use their experiences to help other families build on their resilience and strengths and help them through some of those challenges by offering some emotional support, or just sometimes families just need somebody to listen to them. And, many families who are new to the world of special health care needs find that talking to someone who gets it helps when they know that that person understands what they're going through. And some of the services provided by our family navigators include family to family support, which is emotional support. Just sometimes families need to vent. They just need someone to talk to. So our family navigators are available for that. They can help families navigate systems and they connect them to community resources. We are also really proud to have two bilingual family navigators for Spanish speaking families across the state. And we do have access to interpreters as well for our Spanish speaking families, as well as many other languages. And I do want to note that our family navigators are not social workers, so they have their own scope of practice. So there are a couple limitations in that area that they have, but they are great resources for families. And like I said, family to family support is a really important part of our program, and I think it's a really unique part of our program. Families with a child with autism spectrum disorder or other special healthcare needs often have a unique set of needs and they benefit from those extra supports. Family navigators are here to listen to their concerns, celebrate their successes, help the family build on their own strengths, and offer support based on their needs and use their own experiences to help them through that. And this is where that lived experience is so important and why we require our family navigators have that. So many of our referrals are for newly diagnosed families, and newly diagnosed families are usually starting from square one and may not know about many of the supports that are available to them. So typically, we like to help them with things like applying for the Medicaid waiver, helping them apply for things like Social Security and connect them to other services such as therapy providers, applied behavioral analysis, support groups. They're able to access transportation services sometimes. We are able to help them with their IEP teams at school or other transition services. And some other common needs that families have include, they might be looking for things like play therapy, behavioral therapies, parent-child interaction therapy. We get a lot of requests for active style diapers if their child is incontinent at age 3 or older. We've also gotten requests for safety car seats. We are often working with grant programs like Children at Home, and we often get questions about respite care or families looking for social activities that they can take their children to. So there's a wide variety of services that we might be able to connect a family to. So it's really individualized and it's tailored to whatever that family's specific needs are. So with each call, a family navigator is assessing how the family is doing and what needs they might have, really connecting with that family. And once the family is feeling like they're connected with the services they need, it might be 3 months, it might be a year. It just really depends on that family. But once they feel like they're connected, the contacts will become less often, or the family navigator might even discuss an end to regular contacts with the family, reaching out if something changes or something comes up in the future. Families can be referred to RAP by their primary care provider or other providers. They can be referred by school teams or the AEA, case managers. They also can call in and self-refer to our program. We do have a referral form that can be faxed or emailed, and that information is located at the top of the form. It's located on our website, and we are going to be sending that out after the webinar today. But a referral can also be called in. There's a phone number at the top of that form as well if they would rather call. And then I wanted to point out that we do have a variety of handouts available to provide accurate and evidence-based information for families. We know their first instinct might be a Google search, and that isn't always the most helpful. Um, so maintains a list of ABA providers that serves Iowa families, and this list has grown exponentially since the early days of RAP, and it sometimes needs to be updated even several times a month, which is a great problem to have, and that means that the field is growing and people have more access to services. But we have all these wonderful handouts. There are the common medical interventions for children with autism. Is it autism spectrum disorder or something else? And then we have an autism spectrum disorder fact sheet. Um, RAP has also worked with a committee to develop a caregiver guide for newly diagnosed families. And this is given to all children who have been newly diagnosed at the University of Iowa Autism Center, and it is made available to other providers as well. I know a lot of our regional centers hand this guide out. It is available on our website as well if they want a digital copy. But this guide was modeled after the Autism Speaks 100-Day Toolkit, but was designed to be a little bit shorter and more specific to Iowa. Um, and it is a really wonderful resource for families as well. And many of our resources, including our caregiver guide, has been translated into 6 different languages. And we also have access to interpreter services to work with families as well within, whether it's a clinic visit or a family navigator call. So that QR code leads you to the website that has all those translated materials. And then RAP also provides a variety of webinars and trainings throughout the year. And one of our most popular is our Autism Basics webinar series, which is offered twice a year. And we do actually have one coming up starting September 18th. This is a free series for families, for parents or primary caregivers of children with a new autism diagnosis. And anyone is welcome to attend, but it really is aimed at parents. But we offer this training, like I said, twice a year, and in the spring we will offer it in Spanish as well. RAP has also collaborated with a variety of statewide stakeholders to develop Iowa's autism strategic plan to improve the services and supports for individuals with autism spectrum disorder and their families. And then we do have we do have social media, so feel free to follow us on social media. We post updates about our program and offerings as well as other resources from other organizations as well. So feel free to grab that. But after that really quick overview of CHSC and RAP, I'm going to turn it over to Cheryl, and she's going to go in a little bit more detail about our clinical services.
Thanks, Allison. Yes, I'm Cheryl Jones. I'm a pediatric nurse practitioner, as Allison said. I work in the Ottumwa Regional Center of Child Health Specialty Clinics. And I also do satellite clinics once a month in Keosauqua and once a month in Mount Pleasant, where we see children. And I want to talk about CHSC's clinical services, and I'm talking about our clinical services overall, not just those clinical services for autism. But we will talk, and what I want to do is talk a little bit about the type of evaluation a child receives if they come to our center, and then specific screening tools that we use depending on the reason that the child's been referred to our center. And next slide. As Allison had said, Child Health Specialty Clinic serves Iowa children and youth birth through 21 years up to age 22 who have or are at risk of having a specific or special healthcare need, and they can include chronic conditions, behavioral problems, developmental disorders, and the more complex needs like Allison was talking about, spina bifida, cerebral palsy, those types of things. Next slide. This is our strategic plan for CHSC from some time back, but we talked there about our clinical services and care coordinations. And what our clinical services are comprehensive gap filling services and care coordination to Iowa children and youth with special health care needs and families. I want to stress we are not primary care providers. We do not provide well child exams. We do not provide ongoing medical treatment for things like obesity, like bowel problems, that kind of thing. Those are typically done by the primary care provider. We are a level 2 evaluation consultation resource to address specific concerns that a provider may have, and then work with that provider on providing the services that are needed. That doesn't mean we may not continue to follow those children over time. And there is, we do some medication management. I'll talk a little bit about that, but to stress our services are gap filling, not primary care. Next slide. What do we mean by gap filling? Well, there's a lot of discussion on what it is, but this is one definition. Gap filling means direct health services, and that's like what I provide, where we actually physically see the patient, the child, and do evaluations, supported by Title V staff or resources that are needed by children with special health care needs that are not otherwise accessible in the community. And that's where what Allison was talking about with our family navigators, connecting these kids with some of the resources that they require and that the family requires. Next slide. Clinical services. If you refer a child to child health specialty clinics for an evaluation, typically the clinical services includes a thorough developmental evaluation. It can include behavioral health or mental health evaluation, and a number of the children that are seen in our centers do have behavioral health or mental health diagnoses. And we do autism evaluation, as we will talk more about that. An evaluation of children with drug exposure. My clinic load in Ottumwa is very heavy with children who have had prenatal exposure to drugs, primarily methamphetamine, but those children are seen in our regional centers throughout the state. We see children with feeding difficulties, and that's done in conjunction with our dietitians, where we have children with, particularly like children with autism, can have very significant restricted diets. That means they'll only eat 2 or 3 foods. They're resistant to certain textures. And so we can work with them evaluation of that and then getting them to appropriate interventions. Again, I want to stress, we do not provide primary care. Next slide, please. Okay, next slide. Okay, what the evaluation includes is a comprehensive health, developmental, behavioral, and social history. We look at the broad evaluation of kids. A child may be referred into us and someone says they have speech delay. Okay, it may be what it is, speech delay, but it may be autism. It may be another type of developmental disability. So we need to really have a comprehensive health and developmental evaluation of the children. Patients referred to our center the families are requested to complete pretty comprehensive information prior to the visit to help us direct where we're going to go with our screenings, with our evaluation, so that the parents are sent a packet of information prior to the visit, and the parents complete this information. It may be certain screening tools we've asked for, that kind of thing. So we do get a lot of information before the child is seen. We do a physical examination, we do a neurological assessment of the child, a nutrition assessment, and then depending on the age of the child and the reason for referral, we use a variety of screening tools, and I'll talk a little bit more about that. We also in some centers, we do medication management for children with things like ADHD, anxiety, depression, those types of things. So medication management is provided in our centers. Next slide, please. Okay. The developmental, if the child is sent in, the concern is developmental concerns, developmental delay. Now, this is for younger kids. The developmental assessment tools are primarily for kids under the age of 6. Okay, these types of screening tools. The ASQ3, which I'm sure a lot of you are familiar with, is a screening tool that looks at 5 domains: communication, gross motor, fine motor, personal, social, and problem solving. The ASQSE is a social emotional screen to look for early signs of behavioral or mental health issues in infants and young children. And then another screening tool that is used is the Denver 2. This is a hands-on developmental screen for children up to the age of 6. But those are developmental. If a child is sent in for a developmental evaluation, is their development normal? Is it where we would expect them to be at their age? These are the screening tools we use, and again, these are primarily used under age 6. Next slide, please. For kids who are referred in where the concern is behavioral health or mental health concerns, some assessment tools that we use, again, depending on the age of the child. The Vanderbilt is used basically from 4 and up. We also have a preschool Vanderbilt, which is used for younger children, but it's really not diagnostic. Vanderbilt looks at ADHD and oppositional behaviors. The preschool screen is more saying, better watch, this child's showing signs and maybe at risk, so we need to be sure we monitor this. We do some different anxiety screens. The scared anxiety screen is for kids 8 and up. The Spence anxiety screen is for kids about between 2.5 and 3 to 7 up to age 8 to screen for anxiety. And the issues of anxiety in children now have become so much of a concern that the American Academy of Pediatrics has recommended that primary care providers screen all children over the age of 8 for anxiety because it is very common. And then the PHQ is a screen that we use for depression, mainly in kids 11 and up, but even some younger children will use it, even though it's not norm for that group, because we are seeing depression in children, obviously children younger than 11 or 12. Now, these are behavior assessment tools that may also be used in conjunction with the developmental assessment tools. So if we see this 5-year-old where there's concerns about development, we do the developmental screen and say, oh, they got a little delay in speech, but everything else looks okay. But I'm very concerned because parents are also reporting that they get very anxious with new situations. They are very problem with separation anxiety, or that, my goodness, they're so active, they're all over the place. So we will use both of those screening tools in these children, depending on the presenting concern that we see. Next slide. The autism evaluation, there are several assessment tools we use, and some of them are considered level 1 screenings, which means if they are problematic on this, they really need to have some of our higher level or level 2 assessment tools. Level 1 screening is the MCHAT, and this is for all kids 16 to 30 months of age who are seen. And actually, that's recommended that primary care providers do these screens too at these ages, that these kids need to be screened for autism. If the MCHAT score is high risk, which is a score of 8 to 20 on the tool, then we automatically proceed to administering one of 2 others, what we call level 2 screens, which are more specific and more likely to, if they are high, more likely to have a diagnosis of autism. The MCHAT doesn't want to miss things, so there's a fairly high false positive rate on the MCHAT, but it's because we don't want to miss them. So what we do then is follow up with these other tools, which are more specific, and if the scores are high, more likely to be truly indicative of possible autism. And those 2 tools are the STAT and the RETA-T. The other thing we use for kids between the ages of 31 to 47 months of age is called the SRS-2 preschool screen, it's a questionnaire we ask parents to complete for their children. And if they score at or above the cutoff of the total T-score, which is 15, then we administer the stat. So these are these tools here are the stat, the MCHAT and the SRS2 are considered level 1 screens. We administer those, and if they're positive, then we follow up with these level 2 screens. Next slide, please. The other autism assessment tool over age 4. And this is one that if there's a high score in the SCQ and above, if that score is 15, then that is referred for further diagnostic evaluation. And this is also a questionnaire that's completed by the parent regarding this. And then again, a high score on the SCQ would mean a further evaluation if it's above 15 or above. Next slide, please. Okay, the level 2 screenings for children under the age of 4. Okay, the stat is one we use. This is for kids 14 to 47 months of age who are at risk based on either a positive level 1 screen, a positive SRS2, or professional judgment. As clinicians have seen children for a long period of time, our clinicians basically have a lot of experience in evaluating children with developmental concerns. And so if we say, that wasn't the concern, and even if the score is a little low, I'm still concerned that we can do we may follow it up with a level 2 screen. If the score on the stat is at the cutoff, which is 2 or greater, then the child needs to be referred for a diagnostic evaluation. These tools are not diagnostic of autism. They correlate very well with a formal diagnosis, but they're not a diagnostic tool. They're a level 2 screen. And at this point in time, and I'll talk about a pilot project we're doing where we are actually looking at some diagnostic tools that are being done in a couple of our centers. But at this time, if we identify a child that is positive on the STAT or the READ-A-T, which is the other tool we use, and this is for kids 18 to 36 months of age, same criteria for use. If they had a positive MCHAT, a positive SRS2 or professional judgment, and they score 12 or above, it says refer for diagnostic evaluation. Those diagnoses are, depending on where in the state we're located, are for Mike Center, I'm in Ottumwa, it's either Iowa City or Des Moines, is typically where they go. I think on the western part of the state, they may go to centers in Omaha, that kind of thing, but we have folks that we send to, or centers we send to for that diagnostic evaluation. Next slide. There is a diagnostic evaluation project that Child Health Specialty Clinics is just beginning to start looking at. And it's being done at this point in 2 centers. And it's a pilot project for diagnosis of autism using the CARS-2 diagnostic tool. There's the ADOS-2 is another diagnostic tool that's used, but the one that's being used here is the CARS. It's a rating scale that identifies children 2 years and older with ASD and can distinguish between mild to moderate and severe ASD. As I said, it's a pilot being looked at to see about the ability of our providers and our centers to do this diagnostic evaluation. At this time, consultation for staff doing this is provided by Blank Developmental Center in Des Moines. And one of the reasons we're looking at this is because, as you're probably all aware, there's a huge demand for diagnostic services for children with autism or suspected autism, and the wait list is long. And so providers and different folks are looking at, are there ways we can do evaluation of these kids, credible evaluations of these children and with less wait time. And so at this point, like I said, this pilot started not just a few months back, but seems to be working well in the centers it's being done. Depending on how this moves forward, then that may be that more centers will start doing this diagnostic piece. But at this point, it's a pilot project, which we're excited about and being involved with. Next slide. basically, that's the information. And so I think what Alice and I are open for is questions. I know there were some questions that came in early on, so if there's questions, we're happy to answer those. And I don't know, Sean, if there were some in the question and answer too that folks had, or
Yeah, we had one come in early through the Q&A that asked for help with attaining a free AAC device for an autistic child. I don't know, Allison, if you want to touch on how RAP would be able to help with that.
Yeah, so we could get you connected to a family navigator, and they could certainly help connect you to some resources for that.
what I've found with kids where they need assistance, nonverbal, need assistance with communication and need these devices is it's a process that involves a speech therapist to say they need it, and then a medical provider to say the child has a problem. And then I've been involved with several of these. And so AEA is have evaluated these children and said they would really benefit from this device. And then they work with certain companies that do it. And I'm trying to remember the name of the companies that I've dealt with. But they have a form then that needs to be completed by a healthcare provider to say this child has autism and whatever. And that's been very helpful. And the family navigators, as Allison said, can really help connect. And when we have a request like this, our family navigator, Jennifer Dunning, she works with the speech clinician and myself to say, okay, is everything together? Then those insurance companies, it's because it's free to the parent, if you will, because it's covered, but it's not, it's not just something you write up and free, at least in my experience. But we've been able to obtain devices for several children, and it worked very well. But we worked in collaboration with the AEA speech therapist.
And I know there are a couple programs that if for some reason your insurance won't cover, which I think they usually do, but if for some reason your insurance doesn't cover, I think there are a couple of programs that would help finance a device. So if you have more questions, we can certainly get you
And
connected.
children at home has been helpful. I know
Yeah.
with some kids where a tablet was what they needed with some
Mhm.
communication, very helpful. And Jennifer again has been able to help their families get that set up.
We had one question about the PowerPoint. Yes, we will be sharing the PDF of the slides afterwards. That will be coming with the link to the recording. Are there services for those kids that are 10 to 11 and have not had any of these services but are not newly diagnosed?
Are there services? Is that
Yes, are there services for those kids that are
okay?
the older kids that have not had any of these services but are not newly diagnosed?
Yeah.
Was what came
Yeah,
in.
we serve kids anywhere from birth to age 21, and there are a variety of different services outside of us that we can help them find and get connected with.
The other thing we've been seeing in our clinic is some kids, 10, 11 years old, where they're just now being suspicious and being assessed and going on to be assessed with autism. High functioning autism sometimes can be missed for a while, and the kids have been treated as ADHD or oppositional or whatever. And so, again, the same types of services. Um, us as clinicians, the SCQ would be the screening tool we would use for that. And if there was concerns there, get them referred on for further evaluation. But even if these older kids like this, it's even a little tougher to get them into diagnostic screening because most of the places don't see those older kids so much. So, but that is something we're seeing as a request for autism evaluation screening on older kids. So certainly a need.
Another question that came in, are there family navigators for children with other special needs besides autism?
Yes. Yeah,
Mhm.
we can, our family navigators can serve any kids with a special health care need. It's just our RAP program that's specific to autism, but they can certainly help any of those families.
For the Medicaid waiver, what waiver would a family with a new autism diagnosis want to apply for?
A lot of the times they will apply for the health and disability waiver. If they also happen to have a intellectual disability diagnosis, they can also qualify for the intellectual disability waiver. I know soon all of the waivers will be combined, and so then it'll just be a children and adult waiver, which I think will help with some of that confusion, but I would suggest the health and disability.
Another question. If a parent contacts CHSC for any reported concerns or issues, is the first stop in Iowa City or Des Moines, or can all the evaluations and diagnosis be completed in the outreach clinics that are closer to home for most people?
Well, as I said, at this point in time, there's only two centers that are looking at the diagnostic piece. I mean, children can be referred to us for screening, but it's not going to be a diagnostic thing if it's autism. Now, that's autism. I mean, they may be referred for other reasons. And so we may make diagnoses like of ADHD or anxiety or depression. And then depending on the need, medical management may be done here, or the PCP may do it based on our recommendation. But at this point in time, there's only two centers right now that are looking at the diagnostic piece, but that may be becoming more available. But right now, no, if you send them for us, we would do screening. And we can we can do more to say, no, this child does not look like autism, but there are concerns about, is there intellectual cognitive issue? We need to have cognitive testing. Are there other things? Are there genetic possibilities that children come in and you say, oh, there's some, and there's a family history of, a lot of family members with developmental concerns. We may make a genetics referral, but for autism, at this point in time, we do screening and referral for the final diagnosis.
And one question that did come in during the registration process was any advice when dealing with autistic children in the OR setting. So I am going to put a link. Cheryl did find an article that was helpful. I'll put that link in the chat now, but Cheryl, if you want to.
We had a request to do a training for the Keosauqua Hospital because we have a pediatric dentist now who is doing a lot of oral surgery on children with special needs, and they mostly are children with autism. And the OR staff, what do we do? What do we do with these kids? And this is an article that I found that I thought they found very helpful. If you are OR and having these kids in, you've got to do things ahead of time with them. And this talks about it. They know what the place looks like. They know, if possible, that they can come in and see where there's going to be, because things, children with autism, adults with autism, where they're unsure about what's going on, where there's changes. And then involving the parents. The parents know the children. What is, and if it's possible, if they have items that help them, if they want to bring their dog or their little teddy bear along or their little squishy thing, if it's not a problem, let them do it until they're, sedated, because this can help calm them down too. But this article, I thought the staff there said they found it helpful. The other thing the hospital was looking at was doing a video for families of children with autism who are coming in, because they're seeing so many of them with the dental issues, that the parents could and the child could see, which would show the OR, where you come into the hospital, maybe pictures of the doctors and nurses who will be seeing them. And they were going to work on that as a way to help, because they were seeing a lot of these kids. So anyway, those are some things that might be helpful.
Right, and we did have some very specific questions come in during the registration about like ABA therapy in specific communities. If you still have those questions, feel free to reach out to me and or to Allison directly with those questions, and she can definitely help you get connected in those ways. So while we are waiting for any additional questions to come in, again, feel free to type in the chat box or the Q&A box, but I just do have a few housekeeping items. So for attendees who would like to claim continuing education credit, the University of Iowa Carver College of Medicine has an online portal to complete the course evaluation and to download your attendance certificate. You will be receiving an email with again, with the recording link and the PDF slides, but that will have an attachment with step-by-step instructions on how to claim those credits. I will also put the link here in the chat to access the evaluation as well.
This is Cheryl again. One of the things you might be aware of, children with autism are at high risk for elopement. And there's just an article that came across with a warning for people who deal with autism about the increased number of children and adults with autism who are drowning. And when we do when we talk to families, I always ask, is your child an elopement risk? Do they at risk to run off? That's very common in children and individuals with autism. And so we need to be assessing for that. If they're in school, they need a safety plan as part of their IEP to be sure that if they got a 1-to-1, that's probably okay. But if they don't, and we always talk to families, are you near water? Are you near a busy road? Or are you near railroad tracks? Those are the three areas that individuals with autism tend to go when they elope. And this article just came out, and I don't know, Sean, I can try and share it with you. I'd have to find it, but it just says we got to be aware and we got to be educating. If you're near bodies of water, and most of these drownings were in ponds near homes. So we just need to be aware. And what we've done in our community, we've done training with our law enforcement folks about if a child with autism or an adult with autism is missing, what do? Go with sirens, but watch for water. And so I think we all need to be aware if we're working with children with autism and their elopement risks, what are the safety issues? And be sure that these children are closely supervised, especially if they're near water. But it's a real concern. They said the death rate from drowning has really increased over the last couple of years.
Allison, you may have touched on this. I apologize if I overlooked that, but a question that came in, how long does RAP follow a family?
RAP can follow a family as long as the family needs it. It really depends on, it really just depends on that family. We can follow them anywhere from birth to through their 22nd birthday, but if the family decides that they no longer need our services, then we can end services at that time. But if we decide to end services, a family can always call back in if, say, 6 months down the road, they need help again. So it's really ongoing as long as the family needs it.
And Cheryl, I think this is more directed to those evaluations in some of our regional centers where we're piloting that, but how do you get into the evaluation? Oh, you're muted.
Yeah, we have patients coming in. It was getting a little noisy. In terms of a referral to our centers, there is a request for service form that can be sent in. The request can come from a primary care provider, the AEA sends referrals. We get a lot of referrals from First Five, or a parent can self-refer. And so we get the request for information. Then a packet of information is sent out to the family to complete, which is that really comprehensive health evaluation, releases of information so we can talk to different people. And once that's returned, then the child's scheduled for an evaluation. So in the centers that are doing the two centers that are doing the diagnostic, the evaluation, the referral request would be the same. It would just be what they would, if they did the screening and felt, oh boy, this one's they would do the CARS. And so, but the referral process is, there is a referral form that you can call and make a referral to and say, I have a child, or a provider can say, I've got a child, I'm concerned about autism. Could I get them scheduled? And then our secretary takes the information, gets them entered, and we get the process started. So.
All right. And then one final question that we had come in during the registration, how can you help support families caring for people with autism? I know that's a very broad question, but either of you want to take a stab at answering that?
I think that's where our family navigation would really come into play as far as our program goes. just offering, I think sometimes just that emotional support is the biggest thing. Just having somebody to listen to you and um, somebody that kind of understands what you're going through because it's not always an easy road. So, um, getting them connected to our family navigators and or even, some our clinics provide a lot of care coordination too. So if they need some help, you know, with getting connected to those other services, just calling one of our clinics and we can get them set up.
I think the other support that we offer is our family navigator, even myself, sometimes we participate in IEP or IFSP
Hmm.
staffings. A lot of families really, people, if you don't understand autism in the school, sometimes it's very difficult for these families to, as they advocate for what should be included in an IEP. So I think that's another thing that we do to support families is uh, to participate in staffings. We have a lot of kids, children with autism are at risk to get involved with the Department of Human Services too, because they wander and then somebody says, "Oh, you weren't watching your child," and whatever. So we talk about those high elopement risks. I say, if your child, God forbid, gets away from you, and the Department of Human Services and law enforcement, they can call our center. We can say, your child has autism. We've talked about this. They are at risk. It's not that you're not watching them. And so those are some supports we can do too, because families just have some unique challenges into for this. So anyway, those are some things I think about.
And Cheryl, can you remind us which centers are doing the pilot program with the
It's
evaluation?
the Mason City Fort Dodge centers and the Oline.
All right, well, it looks like that. We don't have any additional questions coming in. So this will conclude our presentation for the afternoon. And I just want to sincerely thank you, Allison and Cheryl, for presenting and for all of you who attended this afternoon. Have a wonderful afternoon.